Tonight, both Desert Regional Medical Center and JFK Memorial Hospital say they are seeing a significant increase in coronavirus patients, marking the highest numbers since the pandemic began. And doctors are concerned it's going to get worse. I spoke today with pulmonologist Dr. Zayed Tanous. Dr. Tanous, thanks for joining us.
You're welcome. Thank you for having me.
How are things right now in terms of coronavirus at both JFK and Desert Regional?
Well, as most of the Southern California hospitals are experiencing, we are experiencing a very significant surge in the positive cases, and our census of COVID positive patients are significantly increased in the last couple of weeks. Almost, I'm going to say 100% increase in the number of COVID positive patients we have now, both here at JFK.
100% increase.
Absolutely. Yeah.
What do you attribute to that?
So, as expected, the combination of the Memorial Day weekend, the protest, opening the stage phase 2, that was accelerated. It was kind of predicted, really, that the transmission of the disease will increase, and therefore more cases will come through to the hospital. So it was kind of expected, quite honestly. But I think all these combination of factors, as the one that I mentioned, are contributing to the increase in the census. So, and this is not only us, this is across Southern California, and more specifically in Riverside County. We track the numbers, and you might see it on the grid, but it is significant increase. This is probably the highest census of COVID positive we had since the pandemic started.
How concerning is this for you right now, and is the hospital prepared if the numbers keep going up?
So yes, from the very beginning, both here and at JFK, we've developed a surge plan, a backup plan of all kinds of equipment, the PPEs, the ventilators, the oxygen equipment, bed capacities, ICU capacities have been prepared from day one. And we really didn't have to use it early on. We were prepared for it, but we never really had to kind of utilize all our resources. And right now, we are at a phase where we may need to. We're not there yet, but we are able to absorb and take care of all those COVID positive patients that come through our doors. So far, we're doing really well. We're prepared. Both manpower and equipment-wise, and room capacity to try to absorb and take care of all these patients who come through our doors.
What about ICU capacity?
Yeah, so ICU capacity also has been increased. We do have right now a significant number of ICU patients that are COVID positive. They're very ill, and ICU bed capacity had been extended also. So we do have a surge plan for the ICU capacity and ventilators and oxygen equipment that's ready to be utilized.
Any numbers that you can provide us in terms of how many patients you have and breaking down the numbers of ICU patients?
Sure. So we have about, in the last, I'm going to say 2 weeks or so, an average daily census of COVID positive anywhere from upper 30s to the upper 40s on any given day. In the intensive care unit, I'm going to say we have average of about between 10 to 15 patients that are critically ill with COVID. We have another 10, 15 who are what we call in a step down, that are not as sick, but yet not as stable as the rest might be. They're ready to go either way. Either if they get sicker, they go to ICU. If they get better, they move to the next level up. And then the rest would be regular monitored floors and so forth and so on. But the average, as I said, is anywhere from the upper 30s to the upper 40s in general on any given day. This has been going on for the last 2 weeks, at least.
And what is the trend among the patients? Are they mostly older, or is it a variety of ages?
That's a great question, because as we all know, this is a disease that basically affects mostly the elderly and patients with other comorbidities and other medical problems. And and that we do see the highest mortality in that age group. We still have that same phenomena, but however, right now, I have to say we do have younger patients, and that are ill. So this is not exclusive to the elderly and the patients with comorbidities. We are seeing the younger patients as well that are critically ill. And if you ask me, I think it's the fact that the workforce is probably coming back a little bit. There's more exposure, more younger population are getting, infected, and a portion of them, or small portion of them, are getting sicker, and are admitted to the hospital, and some in the intensive care unit.
So then let me ask you, doctor, what do you think of the reopening that's happening right now? More businesses are beginning to open back up.
Yes, it does. And, what I think of it, of course, I know it's inevitable that we will open. I think we have to be careful with the way we do it. I think we ought to be exercising all the precautions, the social distancing, all the proper hand hygiene, and self-isolation for any positive, anybody who has symptoms. It's inevitable that we're going to see increase as we open up, but I believe the main thing is to try to concentrate on education of public on all the safety measures that's been recommended all along from day one. This is here to stay for a while, the way I see it. We have to be prepared. I know we do have to open up, but we have to be very cautious how we proceed from here on.
Do most of these patients know where they contracted coronavirus? Was it at a business, at a home, in a specific part of town?
So this is where you do the the contact tracing, and quite a few of them do know how they got it. Certain, for example, workers of nursing homes, for example, or from the inmates from the prisons that we get some. We do have, anything that has any aggregates, aggregation of populations, like, again, the assisted livings, for example. Those places are easier to transmit and spread the disease than other places where there is more social distancing. And quite honestly, there are times we just don't know. Patients come in positive. We don't know how they got it. We do find positive there are of patients who come for different conditions, strokes and heart attacks and other conditions that happen to be positive as well. So it's right now it's all over. It's everywhere. And that's where we have to be very, very careful.
And are you seeing a lot of patients coming in from Imperial County?
Yes, we definitely have, and we still are seeing cases. There seems to be some type of an outbreak that happened on that in that area, and they have reached capacity. So all the hospitals here had opened their doors to try to help out and get patients from there too. But that also is another factor that led to our increase in our census.
Do you think that there could be a major spike in cases if we continue on this current trend come the fall? And if so, what does that mean?
Well, I'm afraid that this is a possible scenario where as we open up, the cases will increase. But what we're hoping that more education and more precautions that are taken will flatten the curve again. Clearly in the fall, when the flu season comes, that will become problematic, where we would have a co-infections going on, and it will definitely increase our admissions for probably both, is what the predictions are for now.
And how important, sir, is it to get antibody testing?
So the antibody testing is a big controversial topic. As of now, for the inpatient population, it doesn't carry a lot of weight. I mean, all what it tells us that an individual had COVID infection. When and whether that person is immune or not, it's still up in the air. It's all been studied.
What about patients at the hospital who do not have coronavirus? What precautions are being taken for them?
That's a great question. I'm really glad you asked that question, because what we have in this hospital, as also probably many other hospitals, but specifically here at Desert at JFK, we have segregated the COVID versus non-COVID patients. So I'm hoping this will never discourage the situation, never discourages the public from coming forward with any complaints of any medical problem. We're still prepared to take care of that, regardless of whether it's a COVID related or a non-COVID related. So this is very, very important. I'm glad you asked that question.
Dr. Tanous, thank you for speaking with us. We appreciate your time.
You're very welcome. Thank you.